Well, now we're going to be talking about left atrial appendage closure. So the idea behind this is the left atrial appendage is a source of at least 90% of thrombi in patients that present with CVA and AFib. And the Watchman device is essentially for in non-valvular AFib. This device is placed essentially over that left atrial appendage, essentially occluding it and preventing a thrombus from forming there. And it's comparable to stroke prevention to warfarin with a decrease in bleeding risk, of course, because the idea is the patient will not be on systemic anticoagulation with this device in place and improve mortality. And that was seen in the JACC study in 2017 that was comparing these two. Anticoagulation can be discontinued in these patients 6 weeks after left atrial appendage closure per MGH protocol. And the idea is that that Watchman device needs to be endothelialized in those 6 weeks, and you still have a risk for clot formation kind of on that Watchman device, which is why anticoagulation needs to be continued for 6 weeks after. And this decreases the risk for stroke and systemic embolism, and it is in the guidelines grade 1B recommendation for surgical occlusion only for patients undergoing cardiac surgery for another indication with a CHA2DS2-VASc score of greater than 2. And this is for surgical occlusion rather than the Watchman device. So if you're already undergoing surgical, other cardiac surgery for another cause, like a valvular abnormality, this can also be done at the same time. And this was seen in the New England Journal of Medicine in 2021. So next up, we're going to be talking about long-term rate versus rhythm control, the recent studies on that, and when each one is indicated.